Okay, so let's try to do a random quiz in radiology. So let's go to Radiopedia, and here I have a quiz. Let's start a quiz and do it together. Maybe I will know something, maybe I will know nothing. So this is the case. We have a 50-year-old female with back pain following trauma without any sensory loss. Okay, let's start. So we have a sagittal T2 image. Let's look what we have here. I think what we can see is in the L4 vertebra, we see in the superior part a little bit of hyperintense, but the main thing we can see is like a protrusion between L4 and L3, and with spinal cord compression, this lesion right over here, you can see this one, but it seems that there is no compression, right? There is compression, of course, but there are no neurological symptoms. The compression is quite intense. Let's look at the T1. Let's look at steer. So there is something there. Axial T2. You can see here the protrusion. It seems like a herniated disc. The nucleus pulposus just ruptured the annulus fibrosus. So it looks like it's a herniated disc below but if it's herniated disc, why it looks like it's in the vertebra and not coming from the vertebral disc? So it must be some kind of a lesion, because if you look carefully you see that this lesion comes from the vertebra itself and not from the disc. So it's not the nucleus pulposus. What I see right over here is the vertebra itself. So let's look at the findings. Burst fracture of L3 vertebral body with associated mild paravertebral and epidural hematoma. Retropulsion of the fracture segment is seen. Retropulse fracture fragment, epidural and paravertebral hematoma are causing moderate compression of the spinal canal, L3 level, and mild compression bilateral. Both transverse process and spinal process appear intact. Supraspinous ligament, ligamentum flavum appear grossly intact. Subtle possible sprain of interspinous ligament is seen. Interstitial tears of bilateral psoas muscle seen. Degenerative spondylitic changes are seen. So this is a burst fracture. This is of course this is trauma. I should have thought about burst fracture. That this is just a burst fracture of the vertebra. That's it. Find consist with the burst fracture of L3 vertebral body. There is also hematoma there. Okay, thank you very much. I did very poorly, but okay, we learned about a burst fracture, which includes the posterior part of the vertebra compared to wedge fracture or anterior segment fracture, and it can also compress the spinal cord and cause hematoma, spinal epidural hematoma, like we saw right over here. Thank you very much, and that's it. Thanks for Radiopedia.